Once upon a time, there was a girl named Katie. Every day, she grew up in a loving home. One day, she started talking to people on the street. Because of that, she realized they were just people with hopes and dreams. Because of that, she went to medical school with the dream of helping these people, until finally, she became a street psychiatrist. And ever since that day, she has lived her calling.
Welcome to A Life Worth Working, a podcast about how we get to the soul of work.
We're your hosts, Michelle Weiss and Dana Allen Walsh. I'm a writer on the future of education and work, and Dana is the senior pastor of a progressive church.
And as always, we love hearing your comments, questions, and thoughts. So please know you can email us anytime at hello@alifeworthworking.com.
Please make sure you subscribe to our show, give it all the stars, and share it with your friends and loved ones who may be searching for more meaning in their work lives.
In this episode, we chat with Dr. Katie Koh, a practicing psychiatrist at Boston Healthcare for the Homeless Program and Massachusetts General Hospital, specializing in the care of homeless patients. She is also an assistant professor of psychiatry at Harvard Medical School. Katie introduced us to the role of a street psychiatrist, which is the crux of this particular interview.
Not every doctor decides to put their life's work into treating the homeless, but Katie was inspired by a seminal moment during her freshman year in college.
One of the many things I love about psychiatry is that it really encourages self-reflection and self-understanding. So I've really given this a lot of thought because I really do feel like it's a calling for me, this work. And I think the best answer I can give for why that may be is that I grew up essentially in the opposite of homelessness, and that I had a loving and stable home, and most importantly, two parents who were incredibly present in my life. And every day as a street psychiatrist, I see how much childhood trauma and abuse and neglect can ravage people's lives and minds. And it's so much of the reason why people end up on the street, these early life experiences that profoundly affect the brain and the mind. And so, with that upbringing, a wonderful, safe town, loving parents, a home that was really a place of stability and refuge, I wish it could be for every child in this world. I went off to college, and it was really the first time I had encountered homeless people. As an undergraduate at Harvard, you see homeless people literally every day when you're walking to class. And I was so struck by that juxtaposition of seeing people living in abject poverty and literally the shadows of the richest university of the world. And that contrast really bothered me and also really piqued my curiosity. And so I just started talking to folks. And one day, I still remember my very first conversation with someone on the street. My friend and I were at some event. We had leftover strawberries, and we decided on a whim we would give it to this man who was in front of the bookstore. And, I'm ashamed to admit it now, but I think I had these misconceptions that these people were on a different wavelength or difficult to connect with. But it was a strikingly normal conversation. We talked about the weather. We talked about the Red Sox. He was thankful for the strawberries, and we went on our way. And I feel like that moment really shattered so many misconceptions I had about people who are homeless and made me realize these people are just like me, but happen to be dealt a completely different deck of cards in life. And had I not been so fortunate to have been born into the loving family I was born into, I could easily be in their shoes. And to this day, that continues to motivate and animate me in my work. And I really see the core of what I do is strive to give my patients the healthy and supportive relationships that my family gave me that they were denied through no fault of their own.
Mm. Katie, tell us about the work of being a street psychiatrist.
It is an absolutely dynamic, fulfilling, meaningful job in which I seek to get to know people who are homeless, who are living on the street, and build relationships and trust with them, and then ultimately provide them clinical care. So asking them about their symptoms, helping understand what diagnoses they may be experiencing, and then helping treat them, whether through medication or therapy or other means, and then hopefully getting them into housing. And that process can take anywhere from days to even years in some cases, but we try and walk with patients on the journey and stand by them through all the ups and downs of that process. And we also continue to follow patients into housing. So one of the many things I love about this work is that one of the principles of Street Team, the team that I work on, is continuity of care. So this idea that even when people move into housing, we can continue to follow them, given that moving into housing can actually be a very fragile and a challenging time for folks, particularly if they don't have the right support. That's actually been one of the most striking things about doing this job, is realizing how precarious that time can be. So I also see patients at home once they move into housing, in addition to on the street. And I also do clinic sessions for patients experiencing homelessness at MGH. And finally, I do research on homelessness and mental illness for part of my time as well. And so I truly love the work and feel incredibly fortunate to be able to do it.
Until I met you and heard you speak, I had not really heard of a street psychiatrist. And so, can you tell us more about how you actually do this work? Like, do you go by yourself? Do you go with the team? Like, how does this actually play out?
Yes, great question, Michelle. Thank you for asking that. So we go out as a team. I have a wonderful interdisciplinary team that I work with 12 people currently. It consists of not only psychiatrists, but also primary care doctors, nurses, recovery coach. So someone who experienced homelessness 10 years himself, had multiple mental illnesses, and completely rebuilt his life. And he's absolutely inspiring and incredible and effective with patients. We also have case managers who help people with getting vital documents, with getting IDs, with helping connect them with work and housing, who play an incredibly critical role in our team. So we all work together. And because patients experiencing homelessness have so many complex needs, each of those roles is so important. And being able to collaborate and communicate in the moment around patients is a core part of what we do. So we do go out in pairs every time. And oftentimes my partner will switch week to week, which is wonderful because it really helps me get different perspectives on patients. And, sometimes I compare the work I do on the street to other settings. And so for many years, I also worked in a general non-homeless outpatient clinic. And, I would put in an order for, a social work consult to see my patient. Despite everyone's best efforts, it could take months for that patient to be seen, and then to discuss the plan together. But during street outreach, I literally can walk arm in arm with my social work colleague and be able to discuss the plan and to talk together about different approaches and different patients. And so it's really wonderful to be able to work in a team-based setting and, yeah, to have wonderful human beings to collaborate with.
And I'm curious about if you could tell us about the work of literally walking the streets, and why is that important rather than inviting the unhoused into a clinic or into a hospital? How does setting play a role?
I think that so many people who are on the street have endured unimaginable trauma, both in their early life and also ongoing while living on the street. And because of that, many people are not going to proactively seek care in places like hospitals where they've been treated poorly in the past in many cases. Oftentimes, when people have been traumatized, they have difficulty interacting with people in positions of influence, like physicians or clinicians. And so it can be really hard for people to take that proactive step to enter a hospital or a clinic. And, even for people who are really well resourced or, have had healthy upbringings, you can try and get an appointment for a psychiatrist and it can take 6 months, right? Despite your best efforts. And so with that background, and in addition, there are people on the street who are using substances, and there are people who have psychotic disorders, which can impair your ability to reason and to even know that you're ill. And so for all these reasons, it's hard for people to walk into an office or to a hospital to get care. And so we really see our role as a street team as going out to these folks, trying to build trust most of all, first and foremost. And then once we have that core of a relationship, that's when we try and ask more about their symptoms, what they may be experiencing, what they need help with, and then hopefully from there get them on a pathway to a better life.
What would you want our listeners to know about the unhoused and who they are?
That they are just people like you and me who have most often had an incredibly difficult hand dealt to them. And that's so much of why they're on the street. I think there's so many misconceptions about homeless people being lazy or not working hard enough. But if you actually get to know these individuals and hear their stories, they're truly some of the most inspiring and resilient people that I've ever met in my life. And people just share these unimaginable stories of early life trauma. Like, one of my patients was locked in dog cages regularly as a form of punishment. Another one of my patients was locked in a closet for a weekend without food or water. Another patient, as a teenager, saw both of his parents die in front of him on separate occasions. In one instance, his father was shot. In the other instance, his mom overdosed in front of him. And so I apologize for the graphic examples, but I think it just conveys the unimaginable pain that these individuals go through. And, if that were to happen to me, if I were to have experienced that, I could never imagine how I could go on and live even anything resembling a normal life. And the fact that so many of my patients have endured this and still strive every day to move forward and to have goals and to still be kind and, want a better life for themselves. I find that so admirable, and there's so much beauty in that. And so I just want to convey that these are just human beings who have struggles, hopes, and dreams just like the rest of us.
Are most folks that you reach out to, are they open to your help, or does it require a different kind of trust building process?
That's a good question. I think there's a whole range, and that's one of the many things I love about the work is that you really have to kind of use your emotional best connect with them. And there are folks who, initially don't want anything to do with you, but then over time you can build that trust and get to a place where they are willing to engage. And then there are folk right away are willing to engage with you and everything in between. So just seeing that amazing diversity and heterogeneity of how people respond is kind of one of the challenges. But we've had incredible success stories, even for people who initially are hesitant about engaging, over months to years. We take an approach on our street team called the long walk, metaphorically speaking, meaning it's so much about building these relationships with individuals over time. And it's so different from the way I was trained in medical school to make these 30-minute assessments of people in the emergency room and figure out their whole diagnosis and treatment plan. So much about street psychiatry and street medicine is about the longitudinal nature of people's hopes and dreams and coming to understand them over time. And so a wonderful example of this is that our street team met a patient outside in 2015. And initially he wanted nothing to do with us, was not interested in our services, but our team kept visiting him when it seemed like he might be more open to it. It's not to say we did that every time, but one day you might get a little bit more eye contact or a wave or a half a smile or half a wave. And you use those moments to talk about our services and give information about our clinic if they ever need it. And so one day in 2022, so 7 years after first meeting this patient on the street, he presented to our clinic at Mass General, walked in, and his presenting issue was interestingly dental pain. So you never know what's going to get people in the door. But he said his teeth were just hurting him so much and couldn't take it anymore. And he had remembered our outreach and, wanted help. And I'm happy to say that patient is now sober. That patient is now housed, and he still regularly comes to our clinic and connects with our team. And it's just a beautiful example of how you can never lose hope and never give up on people because you never know when that turning point is going to be.
Katie, does this work exist in a lot of other urban areas or places where homelessness is kind of quite prevalent, or is this somewhat unique?
It's a growing field, I would say. So Boston Healthcare for the Homeless was the first healthcare for the homeless organization back in 1985, funded through a Robert Wood Johnson Foundation grant. And there's now about 300 healthcare for the homeless organizations throughout the country. But not every healthcare for the homeless program has a street team. There's care for homeless people in shelters and clinics, more traditional clinics. But street teams are unique. And then I think particularly street psychiatry is unique. So I think there are street teams that have case managers or medical providers. And I'm actually part of a group now that's trying to grow street psychiatry and expand it into other cities as well. Because I think it's so critically important for any city that has individuals experiencing homelessness, given how prevalent mental health disorders are on the street. But unfortunately, the resources and attention have not historically been where they need to be. And so I anticipate that in the coming years and decades, the field will continue to grow. And right now it's kind of in its emerging and initial stage.
Were your family and parents supportive of you wanting to take your, prestigious medical degree and then do street psychiatry?
Honestly, this may not be a typical answer, but yes. I mean, I feel so fortunate to have incredible parents. And as mentioned, that's such a driver for why I do this work, because I feel like so many people in this world don't have that privilege. And my parents really raised me and my brothers with this idea of being aware of the privileges that we've been given and using our privileges and strengths to find what moves us, what drives us, what calls us, and give back to the world. My dad always said, always give back, always give back. So, meaning be aware of how lucky we were and use that to move the needle towards progress and equality for people who weren't so fortunate. And so, I think my parents recognized that this was something that deeply moved me, both psychiatry itself and working with homeless populations. I think they may not have anticipated that, but it did evolve over time very naturally. And I think they could feel and honor and respect the passion I had for this work. And so they have been incredibly supportive, and I'm so fortunate for that.
So, Katie, one last fun question for you. If you could do any job that you're not qualified for, what would you do?
Oh, what a cool question. I mean, honestly, so this is just a fun job, right?
Yes.
I mean, so my husband and I are huge Disney fans. And so Disney World is like our favorite place in the universe.
Oh, I love it.
Would you want to work there?
I think working somewhere in Magic Kingdom would be a dream job.
That's
Even
right.
operating the rides or just getting to experience the joy that places like that bring, I think it would be a dream. Although it's interesting, right? Like if you do that every day, I wonder if it would change somehow.
Right.
And I honestly feel like I'm living my dream job now and wouldn't trade it for anything. But yes, that's another alternative. That's really fun to dream about.
Yes. Living the magic all the time. I love it.
There you go.
Thanks for the work you do in this world. It's so important.
It's my pleasure. Thank you both for having this terrific podcast and for trying to more deeply understand this idea of being called to a profession. I think it's really beautiful. I love hearing when I have conversations with friends or other people, when people say they love what they do. That really is something that I find so admirable and meaningful. And I'm always curious to know more because we spend so much of our waking hours working. And I know so many people don't have the privilege to kind of choose what they do for a living, right? So much is about just kind of the labor market and what's available. But I feel so lucky to have been able to really look within inside myself and find what I wanted to do in this world. And the fact that you guys are really trying to explore that with your guests and draw that out for the listeners, I think is beautiful.
What I love about Katie's story is this beautiful example of intellectual humility, having to unlearn everything she was taught in medical school about rigid protocols to quick assessments to meet her patients where they are.
Exactly. That shift from I need a full hour appointment with complete history to a 5-minute walk-in visit is better than nothing. That's such a profound reframe of what effective care actually looks like for people experiencing homelessness.
And it reminds us that sometimes the most important professional growth happens when we're willing to feel inexperienced again, to let our assumptions be challenged by the reality of the people we're trying to serve. She's Dana Allen Walsh.
And she's Michelle Weiss.
This has been another episode of A Life Worth Working.
Don't forget to subscribe and share with your loved ones and friends who may also be searching for meaning and purpose in their work lives, or what we call the soul of work.